Oh, so today we're going to talk about dentals.
Yes, we are.
Because
we are going to start doing dentals at Quick Fix.
Yay! And we're excited about that because
so many cats and dogs have problems with their teeth, or their tartar builds up and they can have problems with their teeth, and it can make them feel a lot better to have their teeth cleaned.
And what we're going to do today is have Dr. Molly, as if this was my personal cat. We're coming in, we're going to do an exam on the couch.
Yeah.
And we're going to have you do an exam on her teeth and just talk us through.
Yeah.
Okay?
Okay, so I'm going to take a look at her, just kind of lift her lip and look at her front teeth and her side teeth. Oh, yes. So she has a lot of tartar on her teeth here on the back. Those back molars, she's got a lot of tartar buildup. The gum line is red there, so she's got some periodontal disease.
Easy.
So there's inflammation in her gums.
Oh, I'm sorry.
So in the very least, she needs those teeth cleaned. She may need some extracted. And then on the front right on the top, her canine is actually broken.
Oh.
And so that when it breaks, the inside of the tooth is exposed with all the vessels and the nerves, so it's painful. It can lead to really bad infections. So the best thing for her would be to have that front right canine extracted.
Okay.
Which can be tricky in cats.
And this is a situation for the rescue. People turn in their cats. They have no idea that their cats are, number one, in pain.
Yeah, most people don't look in their cat's mouth.
They don't look in your cat's mouth. Look in your cat's mouth.
Yeah.
Seriously.
Yeah.
Look in your dog's mouth.
Yeah.
And what you're going to look for, smell.
Yeah.
If your cat or dog has a bad breath, it's almost a done deal.
Yeah.
Your cat's or dog's mouth is infected somewhere, most likely.
Yeah.
So if we go again like this, and Andy, I'm going to scruff her, which doesn't hurt, folks. Everybody's like, don't do that. It doesn't hurt. In fact, there's a semi-paralyzing nerve between the shoulder blades. Helps me to be safe, the doctor to be safe, and it will calm her down a bit. So we can show you what we're talking about. Can you see that, Andy? Of course, we have Andy behind the camera.
That canine up top there is broken, and then she's got a lot of tartar and a little bit of redness along her gum line there.
Yeah, so, and that was enough.
In terms of dental disease, we kind of stage it in dogs and cats, so there's stage 0 through 4. So one would be that with at-home care, you can hopefully undo some of the tartar and buildup that is on their teeth with like brushing and different diets. Stage 2 would be they definitely need to have a dental under anesthesia to have their teeth cleaned. And then 3 and 4 involves more like extractions and bone loss in their mouth.
Lissy has really bad teeth.
Does she?
When I take in cats nowadays, because I've learned so much from you, from just being around now to the vets all day, every day, I've learned so much more. So in her case, it was real obvious to me, and I am a novice dental looker. When I opened her mouth, I went, ooh,
yeah, it's bad.
I think we're going to do a dental. So let's check her out. She's a sweetie, and she's purring.
Oh, I love her face too.
I love it. Isn't it cute? It's like a part Persian.
Yeah, so she's got on this bottom molar there, she's got some root exposure there, so she's had enough dental disease where the root is actually exposed on her back.
Does that hurt?
It does hurt. Yeah, and that's this top molar on the left. Oh yeah, she's got even a kissing lesion, it's called, where the tartar is when her gum closes over her mouth, the part that's hitting the soft part of her gum is irritated just from the tartar on the top of her tooth.
And she's so nice.
She's so nice. Yeah, that left upper molar there looks almost abscessed.
Her dental and the time she would be under and the process would be different, I'm going to say, then, for Bandit, then?
Oh, yeah. Yeah, she probably would be take a little bit longer because she looks like she may need to have a tooth extracted. Which can be hard in cats because their mouth is really delicate. You have to kind of go slow and make sure you don't, because you can break their jaw easily when you do their dental. So, she'd probably take a little bit longer.
Oh boy.
Yeah.
Well, and a lot of times when we get cats in, the old way that I used to know that they really needed the dental is because I touch them everywhere and I'm feeling for things, and whenever I touch the mouth, they would flinch.
Yeah.
Or they'd be like, ah.
Yeah, because
this cat isn't doing that at all. She's a sweetie.
Yeah, she's just so sweet. Must have a
that
high
has to be
point.
painful.
Oh yeah, just imagine.
And yet,
and I have a toothache. I know how much it hurts.
Yeah,
so.
And these guys live with this, and again, here's another owner. When and I have the owners now stay with me while I do their cat's exam, because they're turning over this cat to us. most people are now like, I'm moving and I can't take it. And sometimes I want to say can't or won't.
Yeah, right.
I'm just going to say it. Can't or won't. And then this is a 10-year-old, 11-year-old, 12-year-old cat that they've had forever. And it has all these issues that nobody took care of.
Yeah.
And now it's the responsibility of our organization, because I said yes to her. I know what I'm taking in, but Lord knows if I don't take her in, my heart says, what's going to happen to her?
Yeah, that's just part of owning an older animal. Is
who's going to take care of the teeth?
Yeah.
I know I will.
She'll have to live like that.
So then this rescue absorbs that cost, and it's very difficult to make that up. We definitely don't make it up in our adoption fees. No. Never.
Yeah.
And most of the cats that come in have something wrong with them.
Yeah.
Most of them. This is Freckles, and Freckles is deaf.
Oh.
Yep. Hello. Hi, Freckles. She can't hear me. But she's so cute, and she's purring.
Oh, yeah, she's sweet.
She's a little tortoise shell. This little girl is declawed.
Wow.
She's elderly.
Yes.
I think she's like 13.
Oh, wow, so she is
14.
elderly.
I think she's 14. She's our oldest cat. Wow. She's 14. She has terrible dental problem. She's deaf.
Man, you got all kinds of problems.
And I don't know who's going to come and want her, but she's a little angel, and we'll make you a deal.
Yeah.
Even though we're going to spend the money.
Yeah.
Even in our own clinic, it costs a lot of money.
Oh, yeah, you got to pay everybody.
Got to pay everybody. Got to pay for the dental. See, and her, you touch her side of her mouth, and she went.
Is that what that was? Yeah.
Yeah. So, because I touched the side of her mouth, and hers are painful.
Are they?
So, yeah. So
Let's
here we
check you
go.
out.
Because she's 14.
Hi, baby. Can I see?
Can you, after this, can you let us know, how does this happen? What causes this?
Yeah. Yeah, so her teeth, and they actually aren't as bad as Lissy's. Well, she has got a lot of tartar on that right molar. It looks like she has some root exposure.
That has to hurt.
Yeah, but...
This side is the side she was like, Aya.
Oh, yeah, this side too. Actually, that's how it was. Yeah, she's got root exposure and a lot of tartar on that side. Her gum doesn't look too red, but she definitely needs to have those teeth cleaned, possibly removed, most likely.
I'm sorry.
But the reason that they get dental disease is a lot of times their diet. So wet food is good for cats for a lot of reasons. Like it's high in protein, high in moisture, but it isn't the best for their teeth because they need, they don't brush their teeth like we do, so they need something mechanical to break that the tartar off, and just they don't do regular brushing. That's why it's such a great idea to brush your cats and dogs' teeth at home. I know most people don't have time for that, but if you could brush your cat's teeth twice a day, that'd be amazing. Who would actually be able to do that? But that would help a lot, and that would save you a lot of money for your cat's dentals in their life.
I had a cat that if I tried to brush his teeth, I'd have pulled back a stump.
Yeah.
That's not.
Yeah.
That would never happen with Teddy.
Yeah.
And of course, I have 4 cats.
Right.
They're all males and they're all big guys.
Yeah.
I could probably see myself brushing 2.
Yeah, I know I couldn't brush my own cat's teeth.
Yeah.
Just everyone else should.
Yes. See, we're very honest here. There's going to be some people out there that are going to be able to do that and willing to do that.
Yeah. And also some breeds of dogs, smaller dogs are more likely, just genetics, they're more likely to develop dental disease, like Yorkies and small dogs like that. They usually have a lot of more problems than bigger dogs do.
Oh, okay.
And that's just part of their
Come
genetics.
here, boo-boo. This is Freckles, by the way. I've seen where you can buy like a finger thing.
Yeah.
It's rubber.
Yeah, some dogs
and it's got these little rubber
It's almost like
nubs.
a toddler toothbrush. You can just put your finger in their mouth.
And you just take it and God help you.
Yeah.
The first time before you find out that's not going to work on this cat.
Yeah.
But you just rub it.
And you don't want to use human toothpaste. That has some ingredients that can be toxic to your animal. So you always want to make sure you buy a dog or a cat toothpaste. And if you don't even want to buy the toothpaste, just like the action of brushing with a brush, even if you don't have the toothpaste, will be better than nothing.
Let me ask you this: once a cat is to this point, do you want to brush them? Because wouldn't that be painful?
No, that's a good point. And there's a certain point where you can't the damage they can't be undone. So in the early stages, if you brush, you may get some of that tartar off. But at her point and every other cat that we've seen today, they have to be anesthetized. They have to have their teeth scaled with a dental scaler, and plus or minus have their teeth extracted. That's right. That's a good point. You can't at a certain point you can't go back and undo it. it's permanent damage.
Okay.
Yeah.
Wow, I have learned a lot
Oh, good.
in this. Thank you, Dr.
Well,
Molly. You're so amazing. I love having you on the show.
Good. I love doing
always learn. Hopefully you guys have learned. Thank you for watching.